came in and said to you, I need to get my veneers done now, and you say, well, Invisalign could work. I said, no, I got money. I want to get it done now. And I said, well, I'm going to send this to the laboratory. 2 weeks, come back, we have it. No, I want to do it now. So now it's time for you to do this. So I'm going to, sorry, Dr. Vázquez. I'm going to mark just the areas. I took an alternate impression, poured it with slurry water, looking at it, and saying, okay, what am I going to do to get these guys in the right position? So I need to get an ideal arch on this whole situation. For me, this right here is in a pretty good situation. This right here is not bad. I will bring this guy out, but we don't need to trim anything. Maybe this guy's a little rotated facially, but right now we're not going to take any consideration on this guy. But we know that this guy is really rotated. So I'm just going to mark this, and like I told you before, after reducing, I'm going to mark it with red again so my doctors can see where I reduced, okay? And this is for you to catch up with us, Jenny. So then here I'm going to have to reduce this. I think it's sticking out a little bit. By looking at this angle, we know this is sticking out and this is sticking out here. And obviously this whole area probably endo. Now which tooth is in the right position out of these two? I would think that it's somewhere in the middle. Okay, somewhere around here is where we want to be. Okay, so I start removing these little areas here. So first I'm going to go with the buccal area to make sure that I have a nice arch. Get this out. Reduce a little of this guy. Yes, doctor?
I saw you're going to break contacts and all that.
You're going to have to break contacts on this guy. They're very little because, again, you just want to give yourself a tool for you to do your case. We're looking at a tissue. The tissue is not too bad, so we're not worrying too much. Maybe this one can go a little bit higher here. I'm going to remove this little bubble here. Okay, to me, this guy's a little bit too long. So I'm going to reduce the incisal edge on this guy. Okay, to something that I like. Then I'm going to go on the lingual aspect of these crowns, of these teeth. I'm going to reduce this guy here. Then I'm going to reduce, this is the one that's going to be more aggressively reduced. So as much as we can. And obviously we don't want to hit a nerve at this point. Okay, here's where we're going to start getting tricky. Now we have a nice arch going on here. As I look at it, the teeth are getting in a better position. Okay, and here they're getting a better position. Not much we can do to this guy. But we got to fix this, this, and this. So I'm going to remove the mesial of this lateral. And always thinking about the contour that I want to give this case. Okay, so I'm just not going to break the contact. I'm just going to reduce that angle right there because I know where that tooth is going right now. So whenever I make any cut or any movement with my carver, I always go in the same direction that I want the tooth to go, which is using my imaginary patient's belly button. So I'm always going at the nice angle that I want this kind. So you're always going to see that I make my cuts in this direction. When I start cutting here, I cut this way, thinking that I'm going this direction. Okay? Because in my mind, I'm always training my mind and my eyes to drive everything towards the midline a little bit. Okay? So here we're just going to reduce this guy here. Give us a little bit of space. Here I'm going to just reduce a little bit of this contact here. That's probably going to be one of those craniers, right, Dr. Vázquez? Okay. We can see that the midline is not bad, but do we want to move it with this crowding? I say no. I always try to stay away from moving midlines. Okay, if doctors want me to move midlines, go for it. But we know that it's better to move midlines with appliances, not with veneers. It looks really weird because we said before, 8 and 9 should be mirror images. And we start moving midlines, it's really hard for us to just get that nice line angle here and here to be identical. Very, very hard, almost impossible. Okay. So now we have, I like the contour of my canines. I like the amount of space that I'm getting here on my laterals. This is just pretty much the tough area that I'm dealing with. So I'm going to open this embrasure here. Use a little bit more buckle here. And I kind of like now the position of the central, where I left it. I think I want to be driven by this central right now. It's in the right position. By looking at this profile, it's in the right position. By looking at this area here, it's in the right position. So now I know that I need to bring this central out. This guy now is in the right position, the lateral number 10, and this guy is not in a bad position. So we want to wax this. We don't want to leave it in stone. So once we have the position that we want, we will trim this a little bit more. Now we just give this arch. I'm going to stop at this point and show you what I do to communicate to my dentist what I'm doing, okay? So let's just say you send this to a laboratory. So now what I will do, okay, is mark where I reduce. So I reduce here. I reduce this area here and this area here. I reduce right here. All these little areas here. And the reason, again, like I said before, I do this because then I'm going to wax on top of this, okay, and contour it nice, and those red marks are going to stay inside of my wax. Telling your doctor, telling my doctor, that that's where we need to reduce before my stent can fit for provisionals right before prepping, okay, because we're doing a test drive, okay? So that's what I do. Now, for the sake of you're doing a nice waxing, we're going to go deeper so we can have wax on all these guys. So we're going to go ahead and start just prepping a little bit more. This is already prepped pretty much. I am going to remove a little bit of this mesial angle. And I'm going to reduce a little bit of bulk here. And a stone, so you can reduce as much as you want at this point. We know this guy has to come out quite a bit. This guy here. I'm going to do 8 veneers today. Because we don't believe in 6, right? Just kidding. We're just talking that 6 is tough to do. But we can do it. Dr. Vasquez has the hands of an angel. So we're going to do that and just make this wax up nice and comfortable. So all the stuff. And since we were talking about doing nice incisal embrasures, I'm just going to go over my instrument and just make sure that I have room for me to just give it a nice incisal embrasure. So I have most of my teeth there. I have my shape is there and my line angles are there. So all I need to do is just wax it and make it look pretty. Still the patient is waiting for me in the operatory or maybe in the waiting room having some coffee. And that's all the reduction I would do. Okay? Because we know that this length, to me, this length is pretty good. We may add a little bit of length with wax so we can carve it a little bit. I'm just going to take these little red marks off now. Okay, I'm not reducing too much teeth. So I would do this right now. Okay, so then I can get Dr. Rentz caught up with us. We have a handpiece over there.